Bamlanivimab, a 20-minute drug review. Welcome to the Farm Easy Tutor. My name is Ken Eto, and today we're going to go over Bamlanivimab, which is a monoclonal antibody for the treatment of COVID-19. Many of the new drugs recently coming to market have long, complicated names, especially the new biologics. With the announcement of this new drug, this is certainly the case. Throughout this lecture, I'll be pronouncing the name of this drug as Bamlanivimab. As time goes on, you may hear other ways of saying the name, such as Bamlanivimab or Bamlanivimab. At this time, the definitive pronunciation has not yet been determined. Bamlanivimab is a recombinant monoclonal antibody. The antibody was discovered by scientists from a blood sample taken from one of the first U.S. patients who recovered from COVID-19. The drug binds to the spike protein of the coronavirus. It neutralizes the virus by blocking its attachment to receptors on the human cell, thus inhibiting entry of the virus into the cell. Bamlanivimab received what's known as an emergency use authorization, or an EUA, from the FDA for the treatment of recently diagnosed COVID-19. The EUA means that the drug still remains investigational and is currently not officially approved by the FDA for any indication. Bamlanivimab is authorized for the treatment of recently diagnosed mild to moderate COVID-19 in high-risk ambulatory patients that are not hospitalized. The BLAZE-1 trial was where Bamlanivimab was clinically studied. Patients treated with the drug showed decreased viral load and reduced rates of symptoms and hospitalization. Bamlanivimab was developed from a collaboration between Eli Lilly, AbCellera, and the National Institute of Allergy and Infectious Diseases. The U.S. government purchased 300,000 doses of Bamlanivimab for $375 million, which amounts to a cost of $1,250 per dose. These government purchased doses will be available at no cost to patients, although facilities could charge for administration. Eli Lilly will begin shipping the drug to AmerisourceBergen, who will then distribute it nationally under the U.S. government's allocation program. As far as the drug's indication goes, Bamlanivimab is authorized for use for treatment of mild to moderate COVID-19 infections in adults and pediatric patients who are 12 years of age and older weighing at least 40 kilograms, and who are at high risk for progressing to severe COVID-19 and/or hospitalization. The patients must have a positive result of direct SARS coronavirus 2 testing, and the drug should be administered as soon as possible after the positive viral test and within 10 days of symptom onset. So what does the indication mean when it states high risk for progressing to severe COVID-19 and/or hospitalization? Well, high risk is defined as patients who meet at least one of the following criteria in the table below. In the first box of the table, the patient can have any one of those criteria. And then the next two boxes, the patient can have any one of the listed comorbidities for the specified age range. Bamlanivimab is not authorized for use in patients who are hospitalized due to COVID-19 or who require oxygen therapy or an increase in baseline oxygen flow rate due to COVID-19. Remember, the benefit of treatment with Bamlanivimab has not been observed in patients hospitalized due to COVID-19. Let's talk further about the mechanism of action of this drug. Bamlanivimab is a recombinant neutralizing human immunoglobulin IgG1K monoclonal antibody. It binds to the receptor domain of the spike protein of the SARS coronavirus, thus blocking the virus from attaching to the ACE2 receptor on the human cell. Antibodies are naturally made proteins in our bodies designed to fight infection and are our first line of defense. You can see in the first diagram, without antibodies, the virus can enter a cell and attack the body. In the second diagram, you can see that the Y-shaped protein antibodies binds to the spike proteins of the virus. Thus, antibodies block the virus from entering the human cell. Scientists discovered the antibody Bamlanivimab from a sample taken from one of the first U.S. patients who recovered from COVID-19. Lilly scientists then rapidly developed a replica of this antibody called a monoclonal antibody in less than 3 months. Here's a close-up picture of the SARS coronavirus 2 and its cross-section. You can see where the spike proteins are located. Here's how Bamlanivimab works. In the blood, the monoclonal antibody seeks out the coronavirus and begins to attach to its spike protein. This is an electron microscope photo of the antibodies already bound to the virus. Once the antibodies are attached, the coronavirus is unable to bind to the receptors on the human cell, thus neutralizing it. The dose of Bamlanivimab is 700 milligrams IV for 1 dose, administered over at least 60 minutes. As stated before, the drug should be administered as soon as possible after the positive coronavirus test and within 10 days of symptom onset. No dosage adjustment is recommended in renal impairment. Bamlanivimab is not eliminated intact in the urine, so renal impairment is not expected to affect the exposure. No dosage adjustment is needed in mild hepatic impairment. However, Bamlanivimab was not studied in patients with moderate or severe hepatic impairment. And no dosage adjustment is needed in pediatric patients or in geriatric patients. There should not be any concerns for drug interactions with Bamlanivimab because the drug is not renally excreted or metabolized by cytochrome P450 enzymes. Because Bamlanivimab is a large molecule, it's important to monitor for hypersensitivity reactions, including anaphylaxis. One anaphylactic reaction and one serious infusion-related reaction were reported during infusion of Bamlanivimab in trials. Both reactions required treatment, but both events resolved. Immediate non-serious hypersensitivity events were noted in 2.3% of drug-treated subjects and 1.4% of placebo-treated subjects. The reported events included pruritus, flushing, and facial swelling. If a clinically significant hypersensitivity reaction or anaphylaxis occur, immediately discontinue administration of the drug and initiate appropriate medications and/or supportive care. If a non-serious infusion reaction occurs, consider slowing down or stopping the infusion. There are insufficient data on Bamlanivimab's effect on pregnancy and lactation. The drug has been given in doses up to 7,000 milligrams or 10 times the recommended dose in clinical trials. There is no specific antidote for overdose with Bamlanivimab. The incidence of adverse drug events occurred similarly between the Bamlanivimab group and the placebo group. The most frequently reported adverse event in the Bamlanivimab group was nausea, where diarrhea was the most frequent adverse event in the placebo group. Reporting of all medication errors and serious adverse events surrounding Bamlanivimab is mandatory, especially during this period of emergency use authorization. This means that the FDA MedWatch form must be completed for any adverse event, and it must be reported within 7 calendar days. Use the link to submit the report online. Also, a copy of the FDA MedWatch form must be submitted to Eli Lilly. Use the fax or email listed. Bamlanivimab is available as a 700 mg per 20 ml preservative-free solution in a single-dose vial. It needs to be stored in the refrigerator in the original carton to protect from light. To prepare the drug, follow these steps. The first step is to assemble the drug. Remove the vial from the refrigerator and let it equilibrate to room temperature for approximately 20 minutes. Then gently invert the vial by hand approximately 10 times. Make sure not to shake it. Remove 70 ml from a 250 ml bag of normal saline and discard it. Then add 20 ml of the Bamlanivimab to the normal saline bag. The final volume of the infusion bag should be 200 ml. Gently invert the IV bag by hand approximately 10 times to mix. The diluted infusion bag can be stored up to 24 hours at refrigerated temperature or up to 7 hours at room temperature, including the 1-hour infusion time. Administration of Bamlanivimab requires using an infusion set with a special 0.22 micron inline PES filter. Administer the drug over at least 60 minutes and then flush the infusion line to make sure all the required dose is given to the patient. Nurses should be clinically monitoring the patient during the infusion and observing the patient for at least 1 hour after the infusion is complete to check for hypersensitivity reactions. The BLAZE-1 trial was published in the New England Journal of Medicine in October of 2020. It was a randomized, double-blind, placebo-controlled clinical trial comparing Bamlanivimab against placebo in ambulatory adults with mild or moderate COVID-19 infection who were not hospitalized. Patients are randomly assigned to receive either placebo or a single IV infusion of the drug in one of 3 doses, 700 milligrams, 2800 milligrams, or 7000 milligrams. Treatment was initiated within 3 days of collecting the clinical sample of the first positive test. The trial involved 41 centers in the United States and was sponsored by Eli Lilly. The primary outcome was the change in the SARS coronavirus viral load from baseline at day 11. The secondary outcomes were safety assessments, symptom burden as reported on a questionnaire, and clinical outcomes defined as COVID-19 related inpatient hospitalization. The median age of patients in this trial was 45 years. Only a small percentage of patients were 65 years or older, about 12% of subjects. African American subjects comprised 6% of the group, and Hispanic or Latino 44%. The majority of patients had mild COVID symptoms, about 3/4 of patients, and the mean duration of symptoms was 5 days. The baseline demographics were well balanced. About 70% of patients had at least one risk factor for severe COVID-19, and 44% of subjects were considered high risk. This was a pre-planned interim analysis of data from June through August of 2020. This table shows the mean change in viral load from baseline. Most subjects, including those receiving placebo, effectively cleared the virus by day 11. This represents more than 99.97% of viral RNA eliminated by day 11. Among the Bamlanivimab groups, the viral load at day 11 was lower than that of the placebo group only for the 2800 milligram dose group. A decreased viral load at day 11 did not appear to be a clinically meaningful endpoint, since the viral load was substantially reduced from baseline for the majority of all patients, a finding that was consistent with the natural course of the disease. This is a table of the results of the secondary endpoints. On day 29, the percentage of patients who were hospitalized was 1.6% in the Bamlanivimab group and 6.3% in the placebo group. Results of this endpoint were suggestive of a relatively flat dose-response relationship. In a post-hoc analysis that was focused on high-risk subgroups elderly, and obese, the percentage of hospitalization was 4.2% in the Bamlanivimab group and 14.6% in the placebo group. A lower proportion of Bamlanivimab treated subjects progressed to COVID-19 related hospitalization or emergency room visits compared to placebo-treated subjects. Some of the weaknesses of the BLAZE-1 trial included underrepresentation of key groups in the study. Regarding age, only 12% of patients were 65 years of age or older. The vast majority of patients of this study, close to 90%, were relatively young, with a median age of 45 years. This might not be the best population reflective of high-risk patients. In terms of severity, the study seemed to focus in on patients with only mild COVID-19 symptoms, forming 75% of the total study subjects. Again, this may not be the best population reflective of high-risk patients. And as far as race, although the Hispanic and Latino groups were well represented, the study included only 6% of African American subjects, well underrepresented. Another weakness of this trial had to do with viral load measurements. In this study, the viral load was measured by means of a nasopharyngeal swab, which was followed by quantitative reverse transcriptase PCR. The authors questioned whether collection of nasopharyngeal secretions to determine viral load is accurate, in that the viral load in the air spaces would be a better reflection of the injury response. The authors also questioned whether RT-PCR is an accurate measure of viral neutralization, since viral RNA may persist for some time even in the absence of replication-competent virus. In summary, the BLAZE-1 study compared Bamlanivimab versus placebo in ambulatory, non-hospitalized adults with mild to moderate COVID-19 infection. The coronavirus viral load was substantially reduced from baseline for the majority of patients in both Bamlanivimab and placebo groups, a finding that was consistent with the natural course of the disease. A lower proportion of Bamlanivimab-treated patients progressed to COVID-19 related hospitalization compared to placebo-treated subjects. As far as demographics are concerned, only 12% of patients studied were 65 years of age or older. The majority of patients studied, 75%, had only mild COVID symptoms, and the study group included only 6% of African Americans. Patient counseling information. A copy of the Bamlanivimab fact sheet must be provided to the patient or parent's caregivers prior to the patient receiving the drug. The healthcare provider must communicate information that's on this fact sheet to the patient or parent caregiver. This information will include items such as allowing the patient or parent caregiver the option to accept or refuse Bamlanivimab, providing information on alternative treatments available, including clinical trials, informing the patient of significant known and potential risks and benefits of the drug, and recommending to continue to self-isolate and use infection control measures according to CDC guidelines. Bamlanivimab's mode of action of an antibody attaching to the viral spike protein is an intriguing one. The question is, will it translate to clinical success? For hospitalized COVID-19 patients, the ACTIV-3 clinical trial was halted in late October 2020 because Bamlanivimab combined with remdesivir produced no marked improvement compared to placebo and was unlikely to be effective. In the BLAZE study in ambulatory patients with mild to moderate COVID-19 infections, the declines in the coronavirus viral load from baseline to day 11 were similar in both drug and placebo groups. Since 75% of patients had only mild symptoms, this may have reflected the natural progression of the disease. The BLAZE-1 study also showed a trend that Bamlanivimab lowered rates of patients requiring hospitalization compared to placebo at day 28. Since these are only interim results from a pre-planned analysis, expect more data to arrive. Hopefully, more clinical data from older subjects will be included, since in this current study only 12% of patients were in the 65 years of age or older category. For now, the federal government is incurring the cost of the drug. When this supply runs out, more convincing evidence will be needed to justify a price tag of over $1,250 per patient. Is Bamlanivimab worth it? Well, I've given you a lot of information, but everyone needs to come up with their own decision. And while you're here, take a look at some of the other videos on my channel. We've got a lot in store at the Pharm Easy Tutor. In addition to a 4-part series on antibiotics, there will be upcoming talks on cardiac vasoactive drips, kinetic dosing, treatment of multidrug-resistant organisms, TPN, and much more. So please stay tuned to us. Thanks for tuning in to watch this episode of the Pharm Easy Tutor. I hope you learned something that you could use at school or in practice. If you would like to continue to see more of these types of tutorials on YouTube and to stay informed of when the latest material is available to you, please click on the subscribe button below. Regularly check the description and comment section below for links to updated information regarding the most current issues surrounding Bamlanivimab, including the drug's fact sheet for healthcare providers and for patients, the BLAZE-1 study published in the New England Journal, and a link to find out how much Bamlanivimab has been allocated to specific areas. Stay tuned to the Pharm Easy Tutor channel for more lectures in the upcoming weeks. So until next time, remember to take it easy.